Okay. Hello everyone. Welcome to our first Lunch and Learn session of 2024. I'm Marisa Perkins, Director of Safety Forward, and also I've got my colleague here, Vicky Sutton, who's our Principal Consultant at Safety Forward. The reason why we've chosen health surveillance for today's Lunch and Learn is that it's one of the most common things that comes up on as an audit finding, and sometimes it's made overcomplicated. So we thought it was a perfect opportunity to explain exactly what house surveillance is and why you need it. Um, just a little bit of housekeeping before I start to share the presentation. Can everybody hear me okay? Yeah, okay, perfect. Um, and if you have any questions, oh, thanks for the thumbs up, guys. That's really helpful. If you have any questions as we go along, please feel free to pop them in the comments. And you'll see top left-hand icon is the chat function. If you pop something in there, Vicky will keep an eye on the questions. And I suggest, as this is a short sort of 20-25 minute session, we pick the questions up at the end. But yeah, if you've got any burning questions to ask, just ask them as we go along and we'll pick them up on the last slide. Okay, so let me just share my screen with you. And just to say that this session is recorded for those who couldn't make it on the live session, and it will be released via our next newsletter in February. Okay, Vicky, can you see that?
I can.
Perfect. Okay, so name of the session, what is house surveillance and does my business need it? Okay, so let's have a look at some frequent terminology. Okay, so when we do an audit, you'll hear us talk about what is your occupational health provision. So we'll get you to explain what that service or facility looks like. So when I talk about occupational health provision today, this is what I'm talking about, is that wraparound service that you might have that supports either health surveillance or any health checks you do on your teams. Health surveillance is described as monitoring carried out on individuals to check for an identifiable condition, e.g., noise-induced hearing loss. It could be things like occupational asthma, that's created by dust. So anything that's in relation to the work your teams carry out, is there a requirement for health surveillance to take place? Okay, so first of all, I just wanted to explain that there is different types of health surveillance. If you have your mobile phone handy, just scan over this QR code and it gives a more detailed description from the health and safety executive of what type of health surveillance professionals there are out there. So let me just touch on the different levels first of all. So we've got pre-employment questionnaire. So that's when you have a new member of the team start and you need to find out a little bit more about their sort of their general health and medical history. This could include things such as medication that they're on, so for any special requirements they might have to do with a current health condition. And what this will help you with is to highlight sort of any further um, more more focused medical intervention that might be needed. Um, Second up from that is your annual review questionnaire. So people have completed a health questionnaire on pre-employment, but we need to make sure we still have that duty of care while they're employed with us. So in most cases, we always suggest an annual review questionnaire, and that's certainly something we do with our own team in Safety Forward. So every January, they'll complete a health questionnaire. The team leader or manager would take a look at those to see if there's anything that we need to do as a business to make sure that person stays safe. The next level up is an appointment of a health professional, so more formal health surveillance. So that would involve someone coming out to site, or you may be able to send them to a proper location that's been set up. But quite often they'll come out to site. They'll be in a room that's provided, or they'll come with a unit that's set up to do things like lung function tests and hearing tests. And it's worth noting that some of the clients that we work with have very noisy areas within their businesses. So they have to have a unit on site that's totally separate and quiet in order to conduct some of the health screening tests. Now, one thing you might not know is there is two types of health professional that can conduct health surveillance. The first is an occupational health technician. Now, for a low risk business, or sometimes where there's limitations around budget, a company will go for this option. So you'll have someone come out, sit with sit with the team on an individual basis and run through a series of checks that they have been trained to do. So they're not a qualified health professional. Therefore, they can only identify if there's any issues. Whereas if the company that you use provides an occupational health nurse, so that's the person that's going to be carrying out the screening, they can actually give medical advice. So a good example would be if health screening takes place for someone and it's identified they have high blood pressure, then that occupational health nurse can give help and guidance. I think in most cases it would be a referral to their doctor anyway. But I think as a business, you need to decide when you're choosing your occupational health provision, which is the right level to go for. So there's two types: occupational health technician, they won't necessarily be qualified, but they will have had training to use the equipment that they're using. Or you can go for an occupational health nurse, which will cost slightly more money, but they will be able to give guidance and medical opinions on the day when they're sat with the individuals. So that's just something to consider. Okay, so when is health surveillance required? So HSE guidance recommends that such health surveillance is warranted when there is an identifiable disease or health condition related to the person or work concerned. It is likely that the disease or condition may occur. There are valid techniques available to detect the early signs of the disease or health effects. For example, a technique might be a lung function test. And these techniques do not pose a further risk to employees. So any testing or any surveillance that's carried out shouldn't pose a further risk to employees. So it should remain pretty non-intrusive. So there's three three sets of law that cover the requirement for health surveillance. So we've got COSH, which control of substances hazardous to health. And there is a requirement in there that if your employees are exposed to hazardous substances, that includes dust and fumes, health surveillance is required, and that level of health surveillance is based on the level of risk. And Health and Safety at Work Act talks about our general duties, our general moral duties to our employees to keep them safe. And obviously, health surveillance is a way of doing that. And the management of health and safety at work regulations is all about risk assessment. And our risk assessments we've got in place within our businesses should identify whether health surveillance is required or not, and what those levels should be. Okay, so there's some recommendations for employers who are considering health surveillance. The first thing that needs to be done is a risk assessment carried out of the work. And that risk assessment will cover things like routine exposure, and it should consider what health monitoring is required. And it may be necessary, once we've identified the level of risk in someone's work that they do, that we gain further advice from an occupational health provider. So the very first step is risk assessment. Implementation of a program of exposure monitoring if needed, with input from an occupational hygienist. An occupational hygienist is different to what I've already spoken about. Occupational hygienists will come out to your company. A good example is a manufacturing business that is quite loud. It's a noisy environment, and you have to demonstrate as a business that you're actually that you're measuring your noise levels to understand whether that is in fact having an impact on your workers. So where we work with businesses that are fairly dusty, or noisy, for example, we would always recommend an occupational hygienist coming out at a regular interval such as annually or biannually, just to check the levels of noise are not impacting on your staff. An occupational hygienist will make recommendations such as, which PPE to use, sort of what level of noise protection, or they may advise on the actual layout of the floor space in order to protect employees. So that's what an occupational hygienist is. If you're a low risk business, you won't normally need a help or assistance from an occupational hygienist. Okay, so identify health checks to be carried out at the start of employment in a role and periodically throughout employment. So when you discuss health surveillance with your health and safety advisor, they will be able to talk to you about the correct frequency. So for example, we have a client who works in with closely with hazardous substances. They're a hazardous waste company. And so what would happen with them? It would be more frequent compared to a low risk business. So frequency is very much dependent on the level of risk, but your health and safety advisor will be able to help you with that. Okay, so consider what occupational health support may be needed to assist employees returning to work after long-term sickness absence. So this is applicable whether someone has been off sick with a work-related illness, or they have, for example, something like epilepsy. So we've been helping a couple of clients recently, where they've got a member of staff returning to work who have epilepsy, and it's just about making sure that reasonable adjustments are put in place so that the work they do does not impact further on their health. So we need to determine whether the organisation would benefit from health promotion campaigns and other initiatives. So a really good port of call for health promotion campaigns for your business are IOSH, which is the Institute of Occupational Safety and Health, which my consultants are or a member of. So we quite often share details of campaigns in our newsletters from IOSH. After this session, if you want to Google the No Time to Lose campaign, so that's one that's been running for a good few years. So if you've got people who work regularly in dusty environments, the No Time to Lose campaign is a really good one to look at. They've got great resources. Lots of our clients run initiatives around mental health promotion, so that's something that you may want to consider. Some businesses have an employee assistance program in place. So Aviva's one. We've got Birmingham Hospital Saturday Fund is quite a common one, where they will provide resources for some mental health initiatives within your business. So if you've got an employee assistance program in place, and what that is a hotline that your staff can call up to get things like counselling. They have online doctor's appointments. They will quite often provide you with safety campaign material. Just while we're on the subject, digressing slightly, if you have an employee assistance program in place, and I know some people on this call do, make sure you regularly communicate the benefits of that membership body. It's a great thing to have in place, but it's often the most forgotten about thing. So it really pays to keep promoting the benefits of that EAP. So that's just a little tip. It's just to keep bringing it to the forefront of people's minds. Because when you've got sort of a member of staff who's trying to get in and see their own local GP, they often don't realise they've got an employee assistance programme. We've got a number they can ring up to book a doctor's appointment online, which is a really great facility. If you're a HR professional on this call, then make sure you're monitoring sickness absence for illnesses which may be work related or made worse by work. So for example, if you've suddenly got a few people off sick with breathing difficulties or ringing in their ears, tetanus or something like that, those are the types of things you need to look out for. So as safety professionals or HR, you need to be in tune with sickness absences and work out if there's any common themes there that you may need to look at, because it could be that the workplace is actually making a few people sick in the same way. Okay, so implement an occupational health program to include all the above items with the input from a competent occupational health provider as necessary. There is a registration body for occupational health providers. It's called BOHS. You can look them up. So it's entirely up to you, but a lot of the leading companies are a member of BOHS, like safety professionals are a member of IOSH. It's just a way of making sure that you're using someone that's regulated. Okay, so health records. So health surveillance records are different to doctors' records. It's not the same thing. So any data that you collect in the course of doing health surveillance or your occupational health provisions have to be retained for 40 years. And there's a really good reason for that. It seems like such a long time, but someone may work for you age 25 now and work in an environment that's quite noisy or dusty, for example, or they're exposed to a particular type of chemical on a frequent basis. The impact of where they work now might not show for another 20 years. So if that person then wanted to make a legal claim or some, backpedaling is needed to see of, where did this what person work and what health checks were done on them, that is the reason why. Um, People who are subject to hearing loss over many years. So we often get someone in their 60s who works at a company who over time, over 20 years, has developed hearing loss. Should this ever be researched, say by a legal professional or by the ex-employee themselves, you will need to produce those health surveillance records. Make sure they are maintained and stored in line with GDPR, like you would any HR records. So they shouldn't be just in a drawer for anyone to see. They should remain confidential. Okay, I just wanted to share with you a recent case study, a company called Ross and Catherall. Their head office is based in Burton-on-Trent, but this involved one of their steel places up in Rotherham. So two employees were carried out a task which involved the use of vibrating tools, and it was a constant thing throughout the company's manufacturing process. And both of the operators use the tools for extended periods of time and over a number of years, and were constantly exposed to vibration through the use of hand tools. You may have heard of white finger vibration, but anyone who works with tools or plant and machinery that vibrates can often end up with nerves going dead in their hand. And exposure to vibration is something else that should be subject to health surveillance. So the HSE actually found that there was no hand-arm vibration risk assessment in place for this company. And over time, obviously, the operators are exposed to it and developing these issues in their hands. They also said there was no control measures in place to reduce the exposure levels, with reasonably practicable measures only being implemented following the HSE's intervention. Health surveillance was also inadequate, and this was not carried out annually, and there was no initial health surveillance assessment for new operators. So they were fined a total of £200,000, which is a huge cost. Anything long-term health related, so loss of hearing, loss of sight, hand-arm vibration, which affects the use of the hands, anything long-term generally attracts a big fine because the impact on that person is very much long-term. The fines that people get are also based on the profit that company makes. You can Google a little bit more about this. If you Google HSE's sentencing guidelines, which will tell you a little bit more about how they work out fines for businesses. So, and in the press release, the HSE inspector said those in control of work have a responsibility to assess the risk from exposure to vibration and put in place controls to reduce the risk and ensure that health surveillance is adequate to identify symptoms promptly. Okay, so what should I do next? Okay, so if you don't know much about health surveillance and after this session you're wondering, do we need it? Then get in contact with your health and safety consultant for a discussion. And through a risk assessment process, they will look and see whether it is needed, first of all, and at what level it should be done. If you currently have occupational health provisions in place, just make sure that you review that on an annual basis. But when you have a company audit from Safety Forward, health surveillance is included in that, and we will make comment on the levels that you currently use. And you should actually decide if you haven't got anything in place at the moment, you should decide if there's an impact to the individual's health through the work they do. So a little bit of food for thought after this session, but we are here to help and give more advice and guidance to you. Okay, so let's just stop that. Okay, let's have a look. Is there any questions in the chat, or has anybody got any questions?
We've got no questions in the chat, Maz.
Okay, thank you. Okay, does anyone have any questions about any of the points I've talked about? We've got one coming through now. Okay, thanks, Lindsay. Okay, just give it a minute or so. Yeah, okay, so Lindsay has asked, is there a specific questionnaire that needs to be used? So we do have a couple of questionnaires available. It depends really on the business whether they will be right for you. If you already have an occupational health surveillance provider, I'd strongly recommend asking what questionnaire that they would use, because if the next step up from the questionnaire is then coming out and speaking with your teams and carrying out health surveillance, then they want to make sure that they've got all the information they require. So there's normally a joined up approach with whoever you choose to use is using their questionnaire. But if you are a low risk business and you don't require any sort of in-person health surveillance because you're simply a small office, we do have health questionnaires that we advise you issue at the point of employment and on an annual basis. This is good because if there is, say, someone on medication, for example, who probably shouldn't work at height or maybe be a lone worker, we can certainly pick this up at this stage and do a one-to-one risk assessment with that person.
Okay, we've got another question in there, Maz. One that Andy's put in. What is considered a suitable record that you have to keep for the 40-year one?
Okay, so anything, Andy, anything in relation to the health surveillance. So every questionnaire that goes out and every review. So for example, if Vicky had a team member who came up with a health issue and there were some emails going backwards and forwards to home in on that a little bit more to find out a bit more information, even those emails should be kept because it is personal information that may have to be referred back to at a later date. So any sort of a lot of businesses have a HR system, so we use Breathe. So any kind of interaction or communication with our team will store on that person's personal file, so we can always go back to it in the future.
Okay. We've got a comment on here from Hannah as well. So Hannah said, I'm still concerned about the ongoing health surveillance being reviewed internally and not by a medical professional. I don't think it's appropriate for non-medically trained people to make a judgment or to try and make adjustments, as we may not think of everything. So I'd look to use an occupational health provider.
Yeah, I absolutely agree with that, Hannah. So us again, as Safety Forward, we've got a preferred occupational health surveillance provider that we use. So when we've got a member of staff that comes back to us and says, I'm on this medication, it may affect my driving, we've got a professional we can go to for proper advice. I don't think there'd ever be any expectation for anyone to be able to give proper sort of medical advice who's not trained. And I wouldn't advise you using Dr. Google either, because it will send you down a rabbit hole that it might land you in trouble. So any areas of concern where someone might be on medication and you know uh, anything like that where you feel I do not have the knowledge, or I don't know enough about this, always speak to a health professional. You could quite often someone will have their own medical records, or they'll be seeing their own consultant who provides letters and an update for the employers. You can use those, but again, if a consultant's saying this person should not do a job for the next 3 months, which involves work at height, you have to store all that information in line with the rest of someone's medical records.
Yeah, and we've got one more on here from Andy. So not a question, but from my own experience, sometimes the occupational health technicians do not provide much information and do not have much more capability than to refer you to the doctor. I myself would want a nurse as a minimum if working in a high risk environment.
Yeah, Andy, I totally agree with that. So, for my hazardous waste client, I would, as a minimum, expect them to have an occupational health nurse on site, because I know for a fact that when they've done urine tests, we've had things like isocyanate show up, and that needs intervention, and intervention quickly. We have to have the advice on the day. So the higher the risk, the definitely occupational health nurse. And I think it's important as well, just something I've not touched on is around communication of health surveillance. Employees do get suspicious and quite often think they're going to have a drugs test, and that puts the fear of God in some people. You need to, before you actually roll out health surveillance, you need to make sure that how you communicate it is with as much information and knowledge as possible, rather than them just receiving an appointment and telling them to turn up on a particular day, because people do get nervous. Um, if someone refuses to fill out a health questionnaire, there's nothing you can do about it, but as a business, you've asked the question. However, in a high risk business where someone refuses to have health surveillance, um, it, that is going to need tighter HR intervention, because if you can't monitor that employee to understand if their work, or say the chemicals they're working with, is impacting on their health, then that's an issue, because you can't fulfill your duty of care. So yeah, that's my advice. Just communication is absolutely key, because people do fear health surveillance appointments. And yeah, just make sure that you have the right technicians are fine for lower risk, medium risk businesses. Tend to be the cheaper option, but an occupational health nurse will be able to provide you with instant help and guidance on the day.
Okay, we've got another question, Maz. So if they refuse to fill the form out, then develop issues later in life, would you be liable as a business still?
Okay, so no, you've asked the question, you've got a record of asking a question, you've got a record of them saying, I'm not filling out this. No, you're not liable. I think the issue is where we have businesses who are not asking the questions in the first place. So can you fill out the health surveillance form? Because you have to demonstrate as a business that you are taking all reasonable measures to protect your employees. By asking the question, you are taking all reasonable measures.
Okay, so Hannah's just typing there. I was actually just typing one in just while Hannah's finishing off, Maz, just to say, I don't know about yourself, but I've had in the past some organisations have asked if they can ask their employees to complete an opt-out of wearing particular PPE. What are your thoughts?
No, there's no opt-out of PPE, I'm afraid. This comes up quite a lot. Can my employees sign a disclaimer? No, they can't sign a disclaimer because they are not worth anything in court, because the legal duty is placed on the employer to manage that their employees are wearing PPE as identified in a risk assessment. So disclaimers are not worth the paper they are written on.
Thank you. We've just got one more here off Hannah. Presumably, if they refuse and you suspect there's a medical condition, it will potentially be a disciplinary matter.
Yeah, so presumably if they refuse and you suspect there is a medical condition, it would potentially be a disciplinary matter. I think probably, Hannah, it would need HR intervention, and it would need to be explained to them that you need to know about their medical condition in order to keep them safe at work. Yes, I know, Hannah, you are HR. But if they refuse, they refuse. I don't think that this would be a disciplinary, because the questionnaire part of it, so the low risk questionnaire, they could refuse, and but you have done your duty as an employer. It's the higher risk environment where they're refusing the full health surveillance that's going to be an issue, because potentially as an employer you are continue to expose your people to things that can harm them. So if our high risk clients had someone refusing to fill out a health questionnaire at pre-employment stage, we'd probably advise them to the withdraw the offer, because that person might be asthmatic and we're expecting them to work with isocyanate waste paints and things like that. So it's something, there's so many different scenarios to this, Hannah. I think it would be hard just to do a one blanket policy. But I think for us as health and safety professionals, we would need to make sure our client is fulfilling their legal duty and work with them to encourage the employee to provide the information. It's in their interest at the end of the day.
Okay. And we've
Yeah.
got a question through from Trudy as well. So if you have an employee who you know has an ongoing condition but does not keep you informed, how should you deal with that?
Okay, so I strongly recommend that if you particularly have performance appraisals, which most companies do now, is use that performance appraisal at sort of quarterly or 6 monthly intervals, just to ask them how they are, how the work is there anything about their work or their health condition that needs to be considered for the next sort of 3 to 6 months. And I just bring it up as in at the discussion within their performance appraisal, because I think that's the ideal time just to say to our employees, how you doing? You know, is there anything impacting on your work at the moment? Is there anything to do with your health that we need to know about? People are quite often in fear of losing their jobs over health conditions, so it does need to be handled in a sensitive manner, and they need sort of they need sort of encouragement, and they need to know they come to a safe place to discuss any sort of medical issues they have. um, the terminology that we use quite a lot is reasonable adjustments. So what reasonable adjustments can we put in place to help you with your, disability or illness and the job that you do? So those words, reasonable adjustments, are key for when you're writing up sort of any health and safety information or HR records. So you should be, if if you've had an interview with someone, a performance appraisal, and they've said, "Oh, my diabetes is getting a little bit worse. Or I'm getting more tired in the afternoon." One of those reasonable adjustments might be to work at home 2 days a week. Make sure you document that within their HR record and put, "We are providing reasonable adjustments to this person's health condition by," and list it down.
So Andy's just stating on here, not disclosing any serious health conditions can also pose risk to those around if working in a high risk environment. Absolutely. And Hannah said, I don't disagree, but I do think if you know via gossip, but they won't formally disclose, we are placing them and ourselves at risk.
Yeah, so if it's based on gossip, I think the conversation has to be had with that person and a chance for them to verify that gossip. And I've had a similar situation to that myself in recent years, where I've had to put the question to them and give them a chance to tell me. If they don't tell me, I can't do anything about it, but I've made sure I've evidenced the question that I've asked. But good comments, Hannah, and certainly from with your HR hat on, I can understand why these things are concerning. Some companies have been around for quite a few years and have really grown, and they get to the point where you're trying to backtrack of getting 100 employees to fill out a health questionnaire. So all of a sudden you can find you've got these lots of different issues coming in. So we just encourage businesses as early as possible. If you're on this call or you're listening to this call and you have currently nothing in place, but you're only a team of 5 or 6 people, my advice is to action now, because the bigger you get, the harder it is, or the bigger task it is to start collating all this information in. But no, some really good questions there, some good valid questions.
I think that's all at the end, Maz, and your questions.
No, that's great. Thank you for your interaction and your questions. I will be sending out a feedback form later on today. If you could complete it, and if you have any ideas for further lunch and learns, we'd love to hear what you'd like to hear or see. As I say, this has been recorded and will be available via our next newsletter. But thank you very much for attending. Have a good day.
Thank you.